Examination of lumps and bumps. Today we will be discussing the principles in examination of swellings, also called lumps and bumps. It is important first to introduce yourself to the patient. Next, adequate exposure and lighting is important. In surgery, we talk about the 7 S's of examination of lumps and bumps: the site, the shape, symmetry, scars, size, surface, and sensitivity. To this we add TCML: temperature, consistency, mobility, and lymphatics. It is important to commence the examination of any swelling by inspection. This is followed by palpation, auscultation, and transillumination. On inspection of the lump, we take note of important things. The site, which refers to the position or location. It is important to define the anatomical location of the mass. So this mass is located in the right upper thigh. This may assist us in determining the cause of the swelling. Next, we look at shape. It is important to describe the shape of the swelling. The shape may give a clue as to the origin of the swelling. For example, the shape of an enlarged liver or spleen on abdominal exam is determined by the shape of the mass. So this mass is elliptical in shape. Then we look at symmetry. This refers to uniformity of a swelling. This thigh swelling is symmetrical. Scars. We must observe for scars overlying swellings. Inspection is followed by palpation. On palpation, several things are noted. The size. The size must be accurately measured so that any subsequent changes may be recognized. The size of this swelling is 15 by 6 centimeters. We should avoid using terms such as small, medium, or large, or comparison to fruits, etc. Surface texture. The surface of this swelling is uniformly smooth. Some swellings, however, may be described as irregular. The surface gives an idea of the probable pathological process. The margin or edge of the swelling must also be described as well circumscribed as in this swelling, or irregular, sharp, or rounded as in other swellings. Skin color. We must examine the skin carefully for any changes in color. The color of the skin over an inflamed mass may be red, or the skin over vascular tumor may also be red. Xanthomas seen on the skin may be yellow, and melanomas are black or brown. Hematomas from extravasated blood may be purple, red, or black. There are no skin color changes overlying this mass. We then observe for sensitivity. Is there tenderness elicited on palpation? The examiner must focus on the patient's face during this part of the examination. This mass is non-tender on palpation. However, inflammatory masses may be tender. Temperature. Inflammatory masses or vascular tumors may be warm. The temperature overlying this swelling is normal. It is typical to use a dorsal surface of the hand to assess temperature. Consistency. On palpation, this mass is soft. Consistency may vary from soft to fluctuant to firm to hard. Very hard swellings may be malignant. Fluctuance indicates a fluid-filled mass, for example, an abscess or a cyst. To check for fluctuance, we stabilize the swelling between 2 fingers and press in the center to see if there is bulging. Pulsation. Some masses such as aneurysms may have expansile pulsations. Other masses with a nearby blood vessel may have transmitted pulsation. Keep your hand still for a while to feel for pulsations. Expansile pulsations are recognized by placing a finger of each hand on opposite sides of the lump to see if they are being pushed away. example aneurysms. Transmitted pulsations, however, are recognized by the finger being pushed in the same direction, usually upwards. Mobility. The mass is mobile and not attached to deeper structures or skin. Attempt to pick up the skin over the mass to see if it is attached. Move the swelling in different planes to see if it is attached to deeper structures. Some breast masses may be fixed to deeper structures, for example muscle. Some masses may be fixed to skin and lead to dimpling. Lymphatics. We should examine nearby lymphatics. In this way, we may examine the groin nodes. Enlarged groin nodes may indicate metastases from a local tumor or inflammation. Percussion is mostly of limited value in examination of swellings. However, we proceed to auscultation. This mass has no bruit. However, if there is significant blood flow through a swelling, a bruit may be heard or thrill felt. Transillumination. This can distinguish between a swelling comprised of transparent fluid versus a solid mass. It is ideally done in a dark room. We press with a light on one end of the swelling and look for the lighting up of the swelling. So, in summary, we have examined this lump on the thigh. Based on the findings on inspection, palpation, auscultation, and transillumination, our differentials would include a lipoma or a sebaceous cyst. It is important at the end of the examination to cover the patient and thank them for their assistance. I certainly hope that this has been helpful. Please practice this exam on every swelling that you see. Remember, practice is important in improving your clinical skills. Thank you and have a good day.